Hey guys, welcome back to Yoga with Leona, your site for everything about yoga and breast cancer recovery. Today's video is an exciting one. It's the video focusing on yoga asana, so the physical exercises or the physical part of our yoga practice. So I'm going to talk to you in some detail about how breast cancer treatment, including surgery and radiation, can affect our chest wall and some of the specific problems that we might run into. I'll even demonstrate some of those on myself. And then I'll talk about what modifications we can use. How do we adapt the practice to what our bodies need so that we can safely start a practice and start working on getting our strength and flexibility back. I'll also talk a little bit about lymphedema, which is a big concern for a lot of people, especially as they're thinking about a new exercise program. And finally, a little bit about bone health and asana practice and things that we need to be cautious about and how we use props to protect ourselves. All right, so we're going to start off. I'll switch to the slide view mode. We'll go through some slide presentation, and then at the end, I'll do some demonstration to show you what those modifications might look like, and we'll go from there. All right, let me switch the screen.
All right, guys, here we go. So yoga asana, as I'm sure you've all figured out by now, refers to the part of the 8 limbs of yoga that is the physical exercises. So this is the part that most people in the West think of when they think of the word yoga. So we're going to talk today about some details about yoga asana, how I think it helps us as breast cancer survivors, and then talk about some modifications and things that we need to be aware of so that we can build our yoga asana practice safely and such that it will, help us the most in terms of recovering from our breast cancer treatments. So to start off with, I love this quote from BKS Iyengar, who says, "It is through the alignment of my body that I discovered the alignment of my mind, self, and intelligence." And this just kind of gets to the background idea that yoga asana, of course, is important for the health and wellness of our bodies, but there's this underlying goal of the other benefits, to mind and spirit that are really deeper than the body. So we'll talk a little bit about that. So the term asana translates to a physical posture or a pose, but the literal translation refers more like to the word seat and originally referred to a position used for meditation practices. And some of the very earliest sort of cave drawings and things that were discovered in India that are attributed to the practice of yoga really were basically people sitting in a meditation seated position. So, as I'm sure you probably know, asana practice is not about just achieving certain postures or mastering certain postures, like, for example, thinking, okay, well, as soon as I can do a headstand or a handstand, or as soon as I can put my foot behind my leg, then that makes me a yogi, and that means success in yoga. So yoga asana is not about that at all. Yoga asana is about optimizing the health and the energy in each of our individual physical bodies in whatever condition we bring to the practice. So that's why yoga asana can be very individualized, so that yoga can meet you wherever you are, whatever your starting point, whatever the state of your body is in when you begin practicing yoga. Yoga can help to do this optimizing of health and energy of that physical body. So it's not, comparing yourself to some other person on Instagram who, of course, has a completely different situation than we do. So as Iyengar mentions in the quote above, the practice of asana is important for our physical bodies. And of course, when we have better physical health and better energy circulation throughout our physical bodies, not only do we feel better, but the real deeper or underlying goal of that is that when our bodies are healthier, when we continue to practice asana and get this improved health and energy flow in our bodies, the real goal of that is so that we can better connect with our inner self, our true self, our higher self, maybe even with a divine source, if that's something that you believe in. And when we're able to do that, then we find better peace and harmony, not only in ourselves, we find more joy in our daily lives, but we also find more peace and harmony with those around us. And so, the goal of asana is, yes, to make our bodies healthier so that we feel better, but really to make our lives better and how we move through our lives and how we interact with those around us. So how does yoga asana do this? So yes, of course, it stretches, strengthens, and tones our muscles and joints. It improves blood flow to muscles, joints, and organs, thereby promoting healing and optimal health of all those areas. But it also helps with decluttering, focusing, and training our minds. It helps to balance our nervous system and tones that relaxation response. I talk a lot more about this in the stress video, so check that out if you haven't seen it yet. Yoga asana also opens these chakras and nadis. These are the subtle energy centers and energy channels in our body so that the energy flows more freely through our body, thus also bringing healing energy to all areas of our body. So what about asana specific benefits in breast cancer? Well, as mentioned, of course, stretching, strengthening, and toning our muscles are extremely important, during breast cancer treatment and follow-up. We, of course, can develop generalized weakness because of chemotherapy or other treatments, or maybe because we weren't able to be as active as we normally would be while we were sick with treatment. And so asana can bring back strengthening in a general way to our bodies, but it can also focus on healing areas that are damaged, say from surgery or radiation. So we'll talk a lot today about the chest wall and the shoulder and how asana practice can help us heal those areas and bring strength and flexibility back. So again, here, restoring flexibility to muscles, joints, and other tissues. Asana can also improve lymphatic flow. So we're going to talk in a few slides a little more detail about lymphedema and lymphatic flow. But just briefly here to mention that the muscle action that we perform in asana, as well as the breathing that asana requires, these help to pump lymphatic fluid around our bodies, thereby reducing lymphedema, promoting healing of those areas, and then also improving immune function by helping lymphatic flow be more optimized. Asana also works by improving blood flow throughout our bodies, so to help toxin removal. So if you're just in the time frame where you're going through chemotherapy or you're recovering from chemotherapy, asana can help us move blood around our bodies in a healthier way so that we can remove those byproducts of that treatment. There's a phenomenon in yoga called squeeze and soak. And the idea of this is, imagine you're washing your car and you've got a dirty sponge. And so you've got all this muddy, dirty water in the sponge. And so to clean that sponge, you squeeze the dirty water out. And then when you release that squeeze, that allows the sponge to then soak up new clean water from your bucket. And you can keep doing this squeeze and soak phenomenon until the sponge becomes clean. And the same sort of phenomenon happens in the body. So for example, when we twist our body around our abdomen, we achieve some squeeze and soak phenomenon in some of the organs of our body. And the same could be said for different muscles and joints. So asana benefits our body's recovery in that way as well. It can restore physical endurance and resilience. So you've heard me talk about how often through a breast cancer experience we feel sort of general weakness and we feel a sense of lost vitality. So as we develop our asana practice, it helps us to develop physical endurance and physical resilience, but also mental endurance and mental resilience. So, yeah, just as I was mentioning, the mental aspect of developing resilience, feeling restored sense of empowerment and vitality, improving our thought patterns such that we have healthier or more peaceful thought patterns, and such that we have a better positive mood and outlook. So, in all of these ways, yoga asana can help us take charge of our lives after breast cancer and focus on the idea of a healthier, happier, quote, new normal. So, I always heard patients talking about this, and I thought about it myself, um, after everything that happens in our breast cancer treatment and our surgeries, is our new body just something that we're going to have to get used to, or this quote new normal that people talk about? And I would posit to you the idea that you can make your new normal what you want it to be. Of course, there are certain things like scars and things that we may not be able to change, but if we empower ourselves through the practice of yoga and through the practice of optimizing our mindset, reframing the way our minds work and the way we perceive our situation, that we can actually make this new normal maybe even healthier and happier than we were before cancer. So these are a few pictures, funnily enough, taken from one of my textbooks from medical school. This one's called Essential Clinical Anatomy. It has some great pictures in it. So at the top left, you see the pectoralis muscles there on the front of the chest. If you look at the picture in the upper right, that big yellow area is the actual fatty part of the breast tissue, and then what you see behind that is the pectoralis muscle. So the picture in the upper left is if that breast tissue were all removed, that's what your pectoralis muscle would look like. In the picture in the upper right, you see those little round green things are representing lymph nodes. So our body has lymph nodes all around, but in breast cancer treatment, we focus specifically on certain lymph nodes that drain the area of the breast. So you can see the lymph nodes under the area of the armpit and then up under where the collarbone would be and in and around all of those blood vessels. And then in the lower picture, you can see that the area of the pectoralis muscle has been removed so that you can see underneath it certain muscles there, as well as the nerves and blood vessels that run behind those muscles. So I show you all of this anatomy so that you can understand in a little more detail what exactly is going on with our breast cancer treatment. So when we have breast cancer surgery or radiation, that affects not only these big muscles, but it affects the fascia. That's the connective tissue that sort of surrounds the muscles and the blood vessels and all of these other tissues. Breast cancer treatment, of course, also affects the lymph nodes and the lymphatic channels. It also can affect the nerves and the skin. So the area of our chest and shoulder can be affected in really complex ways. And if you've been through breast cancer treatment, I'm sure you feel at least some of this. So what about yoga asana after breast cancer treatment? So what do we need to know as we're approaching a yoga practice after breast cancer treatment? So as mentioned, the chest wall and the shoulder are the main areas that are physically affected by our breast cancer treatment. So chest wall and shoulder mobility may be the things that we find most challenging. And this is related to scar tissue, radiation fibrosis. There's something called an axillary web syndrome where you develop this sort of tight web-like structures in the area under the arm. This is lymphatic structures that scar. This usually does improve over time, but it may cause some problems for you for a while after your surgery. You may have muscular weakness. You may have a frozen shoulder. I'm going to talk in a little more detail about those in upcoming slides. But so, as I mentioned, the chest wall and shoulder effects of breast cancer treatment are pretty complicated. And so that can really affect what we're able to do as we start into our yoga practice. So chest wall opening poses can be really difficult and or painful. So I'll show you, I'm going to demonstrate after I finish with the slides, I'll show you some physical demonstrations of what that means. But chest wall opening basically is anything that opens the front side of your chest. So poses where the arms are extended all the way out to the sides, or where the arms extend behind the body that really stretch the pectoralis or stretch the residual breast tissue and skin. Those can be pretty difficult and or painful. Any amount of significant weight into the arms needs to be approached carefully. So I've talked a little bit in some other presentations about the idea of lymphedema, and we're going to talk in more detail about that today. But when I first was recovering from my bilateral mastectomy, my surgeons told me that I was not to put any significant weight into my arms for at least the first 8 weeks. And this is so that, you know, the chest wall can heal well, but it's also related to some concern as to whether significant weight into the arms might be a cause for lymphedema. And as I'll mention to you in some upcoming slides, the recent research studies suggest really that there is not significant concern for that as long as you do it cautiously and carefully. So I'll emphasize to you in these upcoming slides as we talk about lymphedema that you can eventually work up to weight into your arm. So for downward facing dog or even handstands or arm balances, you can work up to those. But you need to do so really slowly and carefully and make sure that you're methodical as you move through your practice. So I'm here to help you with that. So prone poses, so prone means lying flat on your belly. These can also be challenging or uncomfortable depending on what kind of surgery you had or if you had reconstruction. I had, as I mentioned, a bilateral mastectomy and implant reconstruction, and so lying flat on my belly is still a little bit uncomfortable because of the implants and especially the side that had radiation. But all of these things there are modifications available for, and so I'm here to help you to understand how to tailor your practice in the way that you need to for your own body, for whatever side effects that you have. And so with slow and steady effort in a safe way, we really can develop a full, strong asana practice. So follow along with me and I'll help you to develop that practice specifically tailored for you. So let's talk about a couple of examples. So back to the pectoralis muscles. So that same picture in the upper right hand corner shows the pectoralis major, and then the pec minor is under that. And so both the pec major and minor can get really tight and contracted due to several things that happen to us with breast cancer surgery. So many of us will develop altered posture related to our breast cancer surgery such that we have a little sort of forward flexion or forward rolling of that involved shoulder. Radiation treatment also can cause this fibrosis or this scarring of the front side of the chest. And when that happens, it causes that contraction of the front side of the chest, which leads and contributes to that rolling forward of the shoulder. Just plain old scar tissue from the surgery itself can cause the same. So it causes this tightness and contraction of the front side of your chest. And then there's a muscle underneath the arm, sort of on the side of the chest wall, called serratus anterior. And you can see it listed there in the picture in the upper right-hand corner of this slide. Some people will have serratus anterior weakness as a result of surgery, and that can also contribute to some contraction and some sort of altered anatomy of the chest and shoulder. So all of this can result in this rolled forward or protracted position of the shoulder. And this can cause pain in the shoulder. It can cause limitations in range of motion of the shoulder. And it can actually eventually lead to contraction of the actual joint space. And this is what people refer to as a frozen shoulder. And this can cause a lot of pain in that arm and shoulder. So the fix or the treatment for this is to really stretch daily to keep these muscles as loose and supple as possible. So At the time of the filming of this video, I'm about 3.5, almost 4 years out from my diagnosis and a little more than 3 years out from my surgery and radiation. And if I don't stretch my chest wall every day, I really get a noticeable recurrence of some tightness and limitation in my right shoulder. That's the side where I had the radiation and where I had more lymph nodes removed. So, as I understand it, this gets a little bit better with each passing year, and I'm hoping that eventually I won't have this tightness and contraction of my chest and shoulder. But even 3 years out, I really need to stick to this program of just regular stretching, and I really find that it helps dramatically. If I go 3, 4, 5 days or a week, then I really have significant discomfort in my shoulder. But if I stretch almost every single day, there's really minimal discomfort. So from my personal perspective and from other people that I've talked to, if we really just can put in some work, we can really help ourselves feel dramatically better in this type of side effect. Let's talk a little bit more detail about the serratus anterior. So I mentioned this muscle in the previous slide. The picture in the upper right-hand corner is a neat picture from a book called The Muscles of Yoga, and it sort of outlines individual muscles and shows what they do in different yoga positions, talks about, what problems you might have if you have difficulty in that muscle. So this is a big sort of combination of strappy muscles that connect the rib cage to the bottom side of your shoulder blade. And so you can see that when those muscles contract, it pulls that shoulder blade down and results in some movement of the shoulder. Now, the lower picture in the lower left-hand corner is there to demonstrate the innervation of the serratus anterior. So the nerve that brings signal to that muscle comes out through the underarm, and it's called the long thoracic nerve, and it branches down from the armpit down into those muscle bellies on the side of your chest wall. So the reason this is relevant to us is that when we have breast cancer surgery, often the surgeon has to get into the underarm a little bit. So whether it's to remove lymph nodes or just to get all of the breast cancer out, sometimes that long thoracic nerve can be irritated or damaged at the time of mastectomy or lymph node dissection. And when that happens, the serratus anterior muscle can become fully or partly paralyzed. And that can result in something called a winged scapula. And a winged scapula means that because the serratus anterior is weak, it's not doing its full job of pulling that scapula or that shoulder blade down to the chest wall or rotating it in the proper way. And so when this happens, the other surrounding muscles may have to try to compensate to make your shoulder work properly, and that can also contribute to shoulder pain. So I actually have a mild version of this winged scapula that is due to this serratus anterior palsy. It's not a complete winged scapula, but I'll show it to you when I do the demonstrations. And basically, in my personal experience of this, I noticed it not too long after my surgery when I started getting back to my yoga practice. And over the couple of years that followed, I have noted that it seems to be getting a little bit better. And I don't know if that's because the nerve is regaining some function and healing, and so my serratus anterior is actually kind of regaining some of its function, or if other surrounding muscles have been able to step in and do some of the work to help improve the function of my shoulder. But in any event, the symptoms have gotten better, and I really attribute a lot of that to my ongoing yoga practice. So again, I'll show it to you at the end when we switch back to the demonstration video. All right, let's shift gears and talk again a little bit more about the lymphatic system and lymphedema. So this picture on the right here is taken from the book Yoga for Cancer, which is written by Tari Prinster. This is the training that I took called Y for C, or Yoga for Cancer, and it's a wonderful program. If you don't already have this book, you should probably pick it up, because Tari does a beautiful job about talking about all the different ways that yoga helps us as cancer survivors. But she has this great picture that demonstrates the lymphatic system throughout the whole body. So you can see the little black lymph nodes that are scattered throughout our body. We have lots of them in our neck, in our armpits, in our chest, and in the groin. And then you can see the little lymphatic channels that connect those lymph nodes to one another and then connect them to the bigger duct in the center of the chest called the thoracic duct. This is kind of like the superhighway of the lymphatic system. You can see the smaller lymphatic channels that go out into the periphery of the body, and these are the ones that sort of collect lymphatic fluid from the tissues and then bring it back to the center of the body through the lymph nodes and into that thoracic duct, where that fluid can then be returned into the circulatory system. So, and then the spleen, of course, is that organ on the left-hand side of your abdomen that acts basically like a great big lymph node. So all of these things are part of the lymphatic system, and the purpose of the lymphatic system is several things. So you probably know about the circulatory system. So that's the part of our body consisting of the heart, of course, but then the arteries and the veins. So those are the main channels that carry blood around our body. And so the circulatory system carries blood around the body such that we can get oxygen and nutrients to our various tissues. So to our muscles, our skin cells, our bones, our organs, and everything else. So in order for that oxygen and those nutrients to get out of the blood vessels and into our tissues, it needs to seep out of those tiny blood vessels or those capillaries that are in the periphery of our body. And then after it brings those nutrients and oxygens to each individual little cell of our body, then waste products are, excreted by the cells, and then that bit of fluid then tries to return to the circulatory system through little capillaries and into the veins. But not all of that fluid is able to return to the circulatory system through the veins. And so some of that fluid turns into lymphatic fluid, and then it returns into the circulation via these little lymphatic ducts. Now, lymphatic ducts are different than arteries and veins in that they have a little flimsier structure, and unlike arteries, they don't have a muscular wall. So lymphatic vessels aren't able to contract to move that lymphatic fluid through. So lymphatic fluid has to move through the body by different mechanisms. I'll come back to that in just a minute, but let's talk again about sort of the purpose of the lymphatic fluid is, so this number one is to move that fluid from the peripheral tissues back into the central circulation. And then second is to cleanse and filter that fluid as it moves through the lymph nodes. So for example, if there were some bacteria or other byproducts that were picked up in that lymphatic fluid, then as the lymphatic fluid moves back through the lymphatic system, white blood cells are waiting in those lymph nodes to cleanse and clear any bad stuff that needs to be taken care of. So these are the things that the lymphatic system does for us. In regards to cancer, the lymphatic system is important in that, say for example, a cancer develops in your breast tissue, and as we know, one of the biggest risks of cancer is as the cancer cells start to grow, they might start to try to move and spread to other parts of our body. So the reason lymph nodes are important in cancer treatment is sometimes a little cancer cell can start to move out of your breast and it can land itself in a lymph node underneath the arm. So this is your body, your lymph nodes, trying to deal with the cancer cells. So your body is saying, hey, we need to deal with this cancer cell and try to chew it up and get rid of it. But unfortunately, sometimes these cancer cells are pretty rascally and they can start to grow and spread into these lymph nodes. So this is why often at breast cancer surgery we need to remove some lymph nodes. So we want to remove them, number one, to know if the cancer cells were starting to spread or not, and number two, to get rid of any cancer cells that were starting to spread. So when a number of lymph nodes need to be removed from an area, such as the area under the arm in a breast cancer surgery, sometimes this can cause difficulty in the lymphatic system. So because we've interfered with the normal little lymphatic highways, then lymphatic fluid can have a hard time getting up and out of the arm. So this is what happens with lymphedema in breast cancer surgery. So because the lymphatic structures have been interrupted by surgery or radiation or the combination of those two things, then the lymphatic fluid gets stuck in the arm and the arm gets swollen. So that's what happens in lymphedema, is your arm develops this painful swelling because the lymphatic fluid can't get up and out. So what do we normally do for treatment of lymphedema? So many of you may have seen a lymphedema physical therapist. So there are special massage therapy techniques that are designed to help try to return that lymph fluid up and out of the arm and into the central circulation. Sometimes compression garments are used, so a compression sleeve or a complicated wrapping procedure can be done for people who have significant lymphedema. There's more research going on these days about lymph node transfer and whether there's something surgical that could be done to try to restore those lymphatic highways such that then the fluid could learn to get up and out of the arm. So lots of different things that we normally do to treat lymphedema. But let's talk about some of the myths that surround lymphedema in breast cancer surgery and breast cancer survivors. So, as I mentioned, when I was recovering from my surgery, I was advised to avoid vigorous exercise and especially avoid certain yoga positions like downward facing dog, because my surgeon, of course, knew that I loved yoga. So, historically, physical exercise, especially any type of vigorous, repetitive, or excessive upper extremity exercise, was discouraged after breast cancer surgery because people were concerned that it might exacerbate or that it might cause lymphedema. So you all probably know, we've been told, don't lift heavy weights or don't do certain activities because those things, it was thought in the past, might exacerbate lymphedema. But let's think a little bit about how lymphatic fluid moves naturally, and then we can come back to what we've learned over the ensuing years about whether exercise causes lymphedema or not. So let's think about, how does lymphatic fluid move? Remember, I mentioned that lymphatic vessels don't have a muscular wall, so they don't contract to move the fluid through. So lymphatic fluid moves partly through the body by movement of the adjacent muscles. So, for example, a lymphatic vessel in the arm would move when the muscles of the arm basically massage it. So when the muscles of the arm are moving, say you're doing some upper extremity exercise, that's going to massage those little lymphatic vessels and cause the fluid to move itself along. Lymphatic fluid also moves related to our breath. So for any of you who have seen a lymphedema specialist, a lymphedema therapist, breathing exercises are a huge part of how they recommend that we deal with reducing our risk of lymphedema. And the reason for that is when we breathe deeply, so the important part there is deep diaphragmatic breathing, so deep breathing into our abdomen, the diaphragm moves up and down within your torso and it massages the thoracic duct. So remember, the thoracic duct was that big lymphatic channel that runs through the deep part of our chest. Well, when we breathe deeply, the diaphragm massages the thoracic duct, thus pulling lymphatic fluid out of the periphery and into that thoracic duct. This deep diaphragmatic breathing also works by creating this vacuum effect in the chest. So when we take a deep breath in, it creates this sort of vacuum or suction effect in our thoracic cavity that pulls lymphatic fluid out of the extremities and into the chest and into that thoracic duct. So in those ways, deep breathing really helps to move lymphatic fluid up and out of our extremities and into the chest, where it can return to the central circulation. And then, of course, gravity can help lymphatic fluid move. So if you are raising the arm up above the head in certain yoga positions, that could contribute to return of lymphatic fluid from the arm. And then lymph massage, as I mentioned in the previous slide, are all different ways that lymphatic fluid moves. So if you really think about it, it makes sense that certain amounts of exercise or certain exercises really ought to help lymphatic fluid get up and out of the arm and help lymphedema instead of making it worse. So there's been a lot of research done over the last period of years, and recent studies really have demonstrated that exercise is safe following breast cancer surgery. There have been studies looking at different types of exercise, including even weight training and yoga and dragon boat racing, which is like a vigorous upper extremity exercise where you're using paddles to propel these dragon boats. And all of these have shown that these exercises do not increase lymphedema in participants that are at risk of lymphedema because of breast cancer surgery. Some of these studies have even shown some improvements in certain symptoms of lymphedema, including things like range of motion, upper extremity strength, or tissue induration, which means like this sort of thickening or swelling of the skin that happens with chronic lymphedema, as well as general quality of life in people at risk for lymphedema. So I don't want to tell you to go out and do like 700 push-ups or start lifting heavy weights immediately because it's safe and won't cause lymphedema. We do recommend caution and starting slowly and gently and working up, progressing slowly and cautiously with whatever type of exercise you're going to do. But I will encourage you that avoiding all exercise and all activity is actually not a good thing in terms of lymphedema. So we really believe that exercise is good for us, good for reducing risk of lymphedema, but we encourage you to proceed cautiously. Now, just so that you know, the most significant risk for lymphedema appears to be in people who've had many lymph nodes removed. So if you've had a full axillary node dissection and you required radiation to the lymph node area because you had significant lymph nodes involved, these are the people that appear to be at the highest risk. So if you have significant risk factors for lymphedema, I would encourage you to see a lymphedema therapist. So they're specially trained in evaluating and treating lymphedema. They can teach you how to do the special lymphedema massage yourself, and they can give you some advice as you're starting into whatever exercise program you're going to do. I'll talk a little bit about lymphedema, and we've got some special movements that I recommend that are meant to minimize your risk of lymphedema as we proceed through the different yoga asana videos. But if you want to get some specialized advice on a one-on-one basis from a lymphedema therapist, I encourage you to do that. All right, so in preparation for the demonstration that I'm going to do after we finish a few more slides here, I want to just mention a few trouble areas that are specific for us as breast cancer survivors and just mention how we modify those. So I'll demonstrate this to you in a few slides after we finish the slides, but a couple of the areas are significant weight into the arms. So as I mentioned, downward facing dog. And I talk about this a little bit in the sun salutation video, in the one where I'm showing you how to start working into downward facing dog and into traditional sun salutations that require weight into the arms. I'll show you some options for that. Primarily it's just starting slow and doing a little bit at a time, slowly over a period. Also, knowing that you can always put your knees on the ground, and that takes some of the weight out of these positions. The next one is extending your arms all the way out to the side. So, for example, as is seen in Warrior II position. So when you're first starting, or if you've got a lot of scarring and that contraction of the chest wall that I mentioned, this may be a little bit uncomfortable to you. So when you're really stretching that pectoralis muscle to extend your arms all the way out to the side, this may feel tight. So I'll show you what to do to modify that. And then the next one is arms extended all the way above the head, so as is done in Warrior I. So again, this can be uncomfortable due to pectoralis or chest wall tightness, as well as to limitations in your shoulder mobility. So I'll show you some options for this. The next one is arms stretched behind the back. So as we might do in a floor bow or a mermaid position, or maybe in a standing bow pulling pose, or what's also referred to as dancer's pose. So this stretches the pectoralis muscle even more because you're bringing the arm back behind your body. This was really uncomfortable for me at first when I started back into yoga, but if you just work at it slowly and gently, then you will eventually get all of that range of motion back. And then depending on what type of surgery and or reconstruction you had, you might have a lot of discomfort when you do anything that causes pectoralis engagement. So for example, in a sort of push-up position, when you're pushing into the floor, so chaturanga or in a cobra position, this can cause some pectoralis engagement. Truthfully, if you're doing chaturanga and cobra correctly, there should be minimal pectoralis engagement, and the strength comes all from your back and your triceps. So I'll demonstrate that to you. But when you're first learning these poses, you may be using a little bit of pectoralis engagement, and that can be uncomfortable. So I'll show you how to work with that. And then the last thing I want to mention in terms of trouble areas is that we need to be really cautious for those of us who have osteoporosis or for a risk of osteoporosis or bone loss. So we need to be really careful with our bone health in certain positions. So any position that puts some stress on your neck. So anything where you're putting your head onto the floor, like for example for a headstand, and anything that's a deep forward bend or deep forward flexion of the spine. So we need to be really careful with those, and I'll show you the precautions for those in a moment. Another quote from my favorite guy, BKS Iyengar, says, "Yoga teaches us to cure what need not be endured and to endure what cannot be cured." So remember, while we may have all these different challenges for certain postures as we're learning a yoga practice, just know that through our yoga practice, we can learn how to modify them, and we can learn how to proceed and how to train our bodies to get back to full strength and flexibility. Here are a couple of pictures from a really neat app called the 3D Yoga app, where they show you which muscles are stretching and which muscles are engaged in different positions. So if you're so inclined, you could download this app and have a look at different yoga postures, and you can see which muscles are really being affected. So in the upper left there, that's downward facing dog, and again you can see that chest wall is really stretched extensively as you move into that position. In the right upper corner, you see a low lunge with the arms extended above the head. That same arm position is what would be done in Warrior One position. So again, lots of stretching of the pectoralis muscles there. In the center of the screen, you see Warrior Two, where the arms are stretched all the way out to the sides, and you can see those shoulder muscles stretching and the pectoralis muscles stretching as well. In the bottom left-hand corner there, that's the floor bow, that one I was describing where it's really extreme stretching of the pec major because the arms are stretching behind the back there. And then in the right lower corner, that's Cobra, the one I was mentioning where you're pushing up against the floor to lift your upper body off the floor. And you can see there that the pectoralis muscle is really not meant to engage. All the strength is coming from your back and your triceps. But when you first start doing this pose, many people will use a little bit of pec engagement until they get the hang of engaging those triceps and back muscles. And then a little more detail about the issue of bone health in forward bends. So forward bending or forward folding places some pressure on the front side of your vertebral body. So in the picture of your spine there on the right, you can see the right hand aspect of that image is the front side of your spine. In the left aspect of that image is the back side of your spine. Now, the front side of our spine is where these big vertebral bodies are, these big bony areas that are separated by the intervertebral discs. And this is the area of the spine that's at risk for compression fractures. So when you bend your body forward, you put a little bit of excess pressure on this area of the spine. And if you have significant bone loss like osteoporosis, then forward bending in the wrong way can put you at risk for some damage to those bones. So this is why I'm always harping on keeping the spine straight or flat when we fold forward. So this is part of the reason why we use the blocks in the modified sun salutations, so that we can keep our spine straight when we bend forward, rather than rolling down one vertebral body at a time or curling the spine forward and putting that excess pressure on the front of the spine. So you'll hear me talk about that all the time in our asana practices, but this is the rationale for it. So if you're not sure what your bone density is, talk to your doctor, ask them if they think that you have significant osteoporosis or if you're at risk for certain types of exercise, and they likely will have had you get a bone density test at some point to evaluate this. All right, so let's move on to the demonstration part of the video. So I'm going to show you a few different yoga poses and how to modify if you've got tightness in your chest wall or your shoulder. And then I'll show you how to slowly move forward with that as you gain strength and flexibility. All right, let me switch the screen to video mode.
All right, guys, let's see if we can demonstrate a few of these postures that we've been talking about, and some of the side effects that we've been talking about, and also how we do some of the modifications to protect you and to help you move safely into your yoga practice so that you can get all the benefits in terms of restoring strength and flexibility. So before I start demonstrating the postures, I wanted to demonstrate for you just on myself a couple of the things that I talked about in terms of things that we can go through in terms of side effects. So remember I was talking about all that pectoralis, chest wall tightness and contraction that results in this sort of rolling forward of the shoulders. So I don't know if you can see it very well from there, but I know if I look in the mirror, I can notice that my right shoulder, which is the one where I had a lot of lymph nodes removed and I had radiation to my chest wall, this right shoulder rolls slightly forward unless I'm really conscious of holding it up and back. And this is just something that's a side effect of treatment. So because of tightness in the chest wall and all of those muscle effects and stuff that I described in the slides, I've got a slight forward rolling movement of the shoulder. And you can see why that would result in some chronic shoulder discomfort and even limitations in range of motion. So that's the right chest wall tightness and rolling forward or protracted movement of the shoulder that we often see. I'm going to take my shirt off just for a minute so that you can see the shoulder blade situation a little bit better. So then I want to show for you this right shoulder blade, which has a mild winging of it. And as I mentioned, it does seem to be getting better. It was worse a couple of years ago when I first was recovering from surgery. But I'm going to come into a plank position and then move through some shoulder movements, and you'll notice that this shoulder blade sticks up a little bit further than the one on the left, and that's because of that, I've got abnormal serratus anterior muscle function on the right chest wall here, so it's not pulling that shoulder blade down onto my back where it should be. So I'm going to come into a plank, and I'm going to, normally in a plank we let our head stretch forward, but I'm going to let my head hang down so you can see the shoulder a little bit better. So just have a look at my two shoulder blades and see as I move through some of these positions that the right shoulder blade doesn't move exactly the same way that the other one does. And so I demonstrate that for you just so that you can see that, most of us after breast cancer surgery, it's complicated, the things that they do to our bodies. And so most of us are going to have some sort of asymmetry in our chest or our shoulders, but that's okay. And it doesn't mean that you can't do a lot of yoga poses. You just have to work into them slowly, work into them with the proper form. And, over a period of time, you'll build the strength and the flexibility and the range of motion, all that stuff, you'll build it right back. So that's kind of what I'm working with, and it's, I just work at it each day, and it, as I said, it does really seem to be getting a lot better. All right, so let me demonstrate a few of the common yoga poses and how we might need to modify those. So the first one that I talked about was downward facing dog. So Downward facing dog normally looks like this. So it's hands on the floor, hips in the air. The heels don't have to come down to the floor. You can bend your knees if you have a lot of hamstring tightness. But the idea here is a stretch through the low back. And then for us as breast cancer survivors, it can be a nice stretch through the shoulders. So you can see as I push my chest down and back, I get some more stretch through my pectoralis muscles and through my shoulders. Now, of course, as I mentioned in the video, we don't want to jump into sitting in downward facing dog for long periods of time right after our surgery. So you need to wait a period of time, make sure that your surgeon has said it's okay for you to start doing some of this type of exercise. And then you want to do it very slowly, little bit at a time. You can always put the knees down. So for example, if you're going to a yoga class and they're putting you in downward facing dog and you're not ready to do it yet, this is always a perfect option. So you just sink your hips back and that takes all that pressure out of your arms, and you can get the same stretch through your low back and shoulders with knees on the floor. If you have a look at my videos about the sun salutations, I show you a kneeling sun salutation that moves through downward facing dog just for very brief periods of time. So that's a nice way to start working through downward facing dog if and when you feel like you're ready for it. All right, the next one is any position where the arms are stretched all the way out to your sides. So this is warrior two, where the front knee is bent, back foot is perpendicular to your mat, and arms stretch all the way out to the sides, and then you traditionally look over that front hand. Now, if you are just recovering from your breast cancer surgery, this might feel really tight and uncomfortable for you. It was for me when I first started back to yoga. So things that you can do are bring the arms forward. So I'm going to shift my body weight forward so you can see the arms are coming into like a V instead of stretched all the way out to the sides. So this is just going to ease up on that tightness on the chest wall. So a very simple change in position can make the posture more approachable to you. If you need to bend the elbows a little bit, that can sometimes help too. So I invite you to, as you start into your yoga practice, really notice what you're feeling. Yoga practice, it's not about doing the pose the way someone else looks doing it. It's about finding where it works for you, where you're stretching and strengthening the right muscles, but you're also working in your safe range of motion. So I invite you to just explore and see what feels right. Maybe stretching all the way out isn't quite right yet, and you need to adapt and change and see what's working for you. All right, so that's warrior one. Most common thing would be just to bring the arms forward a little bit to relieve that pressure on the chest. All right, what about arms to the sky? So as the picture in the slide presentation showed, a low lunge and arms traditionally stretching all the way up to the sky like this. Now, this may be a lot for your shoulders and for your chest wall. I know it was for me when I first started. So options here include bringing the arms into a cactus shape. So instead of arms all the way to the sky, arms come down into a cactus. Or you can just bend the arms slightly. You can have them in any other form that feels good to you or feels like it's acceptable to you. If it's all too much, you might just bring your hands to your heart. And then eventually over time, you start working them back and up, and then eventually moving all the way to the top. So that'd be the same in warrior one. So when we're in warrior one, with back heel at the floor, front knee bent, arms up, same exact position of the arms. So cactus is a great option here, or hands at the heart if it's all too much. All right, the next one is going to be arms extended behind our back. So in several positions in yoga, we stretch the arms behind our back this way. So one of the ways we do it is interlacing the hands behind the back and just rolling our chest back. And you can see that that's a big stretch through the pectoralis muscles. It actually feels amazing. I love that and do it almost every time I practice because it really helps to keep that tissue stretched and open. But when I first started back to yoga, it was pretty uncomfortable. Let me just demonstrate a couple of postures where this would come into play. So one is called a floor bow or dhanurasana. It's where we lie on our belly. And then traditionally you would bend both knees and reach for your feet. And then you strengthen your back by kicking the feet up as you lift your body up. But you can see that that's a lot of stretch. So when you're first starting back to yoga and say you're going to try to do this posture, one option would be to just take one foot at a time. So you release one leg and you just do one side at a time. So that allows a little less pressure onto the arm. The other thing you could do is use a strap and loop it around your foot such that the distance between your hand and your foot could be extended a little bit further so the stretch wouldn't be quite as extreme. That same position is going to come into play in a standing posture called dancer. And this is one where I noticed it a lot when I was first coming back to practice. So dancer is a standing balance where we grab our foot and then we work toward balancing as we shift our body weight forward and kick the foot back. And again, you can see how big of a stretch this is going to be through that chest wall. So when I first started back to practice, I just took it really, really slow. You know, I wouldn't go all the way into it. I just stop right here. And if this felt like a stretch, this is all you need to do today. So, and then you gently, as the chest wall stretches more, you gently can get deeper and deeper into the pose. So again, it's really primarily about just listening to your body and feeling what you feel. You never want to feel such a significant stretch as to have real pain from the pose. So listening to your body, moving in your safe range of motion, and then taking that slowly, slowly as you progress. All right, let's talk about pectoralis engagement. So I've been talking about pec stretching primarily, but sometimes when we engage the pectoralis, that can be really uncomfortable, especially if you're like me and you have had an implant reconstruction where the implants are placed under the pectoralis muscles. So if you have that, you know about it, and you know that when you engage your pectoralis muscles, it sort of squeezes the implants and it results in this sort of funny looking muscle appearance to your chest. But let me show you a couple of positions where this might come into play. So again, when you're on your belly, so another spine strengthening pose that we do is called cobra. So in cobra, the hands are just under the shoulders and you lift your upper body up, and you're supposed to be using primarily the muscles on your back and your triceps, so the back sides of your arms, not pushing up with your chest like you would do in a push-up, like from gym class in elementary school. So this is not what we're supposed to be doing. The proper form for cobra, all the muscle effort comes from your back and your triceps. So in a lot of poses, it's, you know, getting the proper form will help you not have the discomfort, for example, in your pectoralis. So when you're practicing cobra, just think about it and really feel the muscles engage on the back side of your body to pull you up instead of pushing with the front side of your body. And then the same is true for chaturanga. So if you've got some experience with yoga and you're working on the sun salutations and you're working through chaturanga, it's the same idea. So chaturanga is sometimes called a yoga push-up, and it looks like this. So the chest comes forward slightly, elbows back toward the hips as you lower down, and we use it primarily as a transition between a plank and upward facing dog. But again, it's not a push-up like gym class, you know, so most of the effort is not coming from your pecs, it's coming from your triceps. So you're lowering down. Proper form helps keep all the strength in the triceps and not in the pecs. All right. So those are the main postures where I think you might have modification options. If there's one that you're working with and you're not sure what to do, send me an email, you know, and I can try to see if I can help you work through it. But again, a lot of it is getting used to what your body feels like and just adapting as you need to. Now, last thing before I let you go, I want to just go through again the protections for our spine and the way we use blocks and other props to help us always fold forward with a flat back. So remember, if you watched the video on the modified sun salutations, we use blocks to allow us to keep our spine straight. So for our modified sun salutations, we stretch our body to the sky, and then we use the blocks to come forward with a flat back. So you can see I'm hinging from my hips with a flat back instead of curling forward. This is the risky place. You don't want your spine to curl forward as you reach for your blocks, because then you're putting all that pressure on the front of the spine. So we bend forward from the hips, flat back as we reach for our blocks. Knees can bend if you've got tight hamstrings, so knees bent, bending forward with a flat spine, reaching for your blocks. Now, if you don't have a bunch of yoga blocks lying around, I've seen some really interesting use of home items. So you could take a couple of rolls of paper towels and use those instead. So you could bend forward from your hips and just reach for your paper towels. Now, paper towels aren't going to hold a ton of weight, but they're enough really just to give you that stability to do the stepping back and all of the other things that we do for our sun salutations. So feel free to use paper towels or something until you can get your hands on some yoga blocks. Now, the same idea of forward folding and flat backs is important in seated forward folds. So sometimes we take a seated forward fold, and the same exact idea applies. So you don't want to roll your spine forward, curling like this, and then really be like putting a lot of jarring and pressure on the front of your spine. You want to roll your hips forward so that you can stretch your spine nice and long, and then you just stretch forward as far as you can with keeping that spine straight. So see how flat my back looks? I'm not curling down and compressing the front of my spine. I'm stretching forward as though someone were pulling from my chest. All right. So as I said, if you're having questions or you're struggling with certain posture or something, shoot me a message. I'll see if I can help you. The important point, I think, is just start wherever you are and know that you can slowly, over a period of time, weeks and months and years, you can slowly progress and get your body back to strong and flexible so that you can have whatever type of yoga practice you want. All right, guys, so keep working at it. Keep staying in touch. Thanks for being here. Namaste.